Welcome back to G Fun Facts Online. Today, we are going to dismantle one of the most deeply ingrained habits in modern life. It is a reflex that millions of us perform every single day without a second thought. You twist your ankle, you wake up with a stiff back, or you push too hard at the gym, and immediately, you reach for the bottle of ibuprofen, or you grab a bag of frozen peas. The goal is simple: stop the pain, stop the swelling, and make the inflammation go away. For decades, the medical establishment, sports coaches, and concerned parents have treated inflammation as the villain. It is the enemy that must be suppressed, iced, and drugged into submission. But a massive paradigm shift is currently sweeping through the fields of regenerative medicine, immunology, and orthopedics. Emerging research is telling us that our seek and destroy approach to inflammation might be fundamentally flawed. In fact, by rushing to silence the body's alarm bells, we might be actively preventing the repair crews from doing their job. Today we are going deep into the biology of tissue repair to understand why inflammation is actually an evolutionarily conserved, biologically essential phase of healing, and why the future of medicine isn't about anti-inflammatories, but about something called pro-resolution. Let's start by looking at what actually happens inside your body when you get hurt. Because to understand why suppressing inflammation is dangerous, you have to understand what inflammation is doing in the first place. When you suffer a trauma, whether it is a muscle tear, a bone fracture, or a surgical incision, your body orchestrates a symphony of biological events. This symphony plays out in three overlapping movements: inflammation, proliferation, and remodeling. The moment damage occurs, the body initiates the acute inflammatory response. This isn't a mistake or a malfunction. It is a rescue mission. The first responders are platelets. They rush to the scene to clot the blood and stop the bleeding, but they also release chemical signals, chemotactic factors, that act like a siren call to the immune system. Within hours, neutrophils swarm the injury site. Think of neutrophils as the demolition crew. Their job is to clear out bacteria, dead cells, and debris. They sterilize the wound and prepare the foundation for rebuilding. But here is where it gets incredibly sophisticated. The next wave of cells to arrive are monocytes, which differentiate into macrophages. Initially, these macrophages arrive in what is called the M1 phenotype. These are pro-inflammatory warriors. They continue the cleanup and secrete aggressive cytokines like IL-1 beta and TNF-alpha. This is the phase that hurts. This is the swelling and the heat. But, and this is the critical turning point that most people miss, after a few days, a miraculous shift occurs. If the healing process is allowed to proceed naturally, these same M1 macrophages switch their phenotype. They transform into M2 macrophages. The M2 phenotype is anti-inflammatory and pro-reparative. They stop destroying and start building. They release growth factors like TGF-beta, VEGF, and IGF-1. These are the signals that tell stem cells to wake up, tell blood vessels to grow, and tell the body to lay down new collagen. Here is the key insight that changes everything. This switch from the destructive M1 phase to the constructive M2 phase is driven by the initial inflammatory signals. If you block the initial inflammation too aggressively with drugs or ice, you never trigger the switch. The demolition crew never leaves, or worse, the construction crew never arrives, because they never got the call. This leads us directly to the agents of suppression that we all have in our medicine cabinets. Let's talk about non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen, naproxen, and aspirin. These drugs work by inhibiting enzymes called cyclooxygenase, or COX enzymes. By blocking these enzymes, they stop the production of prostaglandins. We usually hate prostaglandins because they cause pain, but biologically, prostaglandins are the key that starts the engine of tissue regeneration. They regulate the activity of osteoblasts, which build bone, and satellite cells which repair muscle. When you take an NSAID, you are effectively hiding the injury from your body's own repair mechanisms. Then we have corticosteroids, like prednisone or cortisone injections. These are even more potent. They work upstream of NSAIDs, blocking almost all inflammatory mediators. While this creates a miraculous reduction in pain and swelling, it induces a state of suspended animation in the wound. It halts collagen synthesis and constricts blood vessels. Long term, this leads to tissue atrophy, thinning skin, weaker tendons, and brittle bones. And what about ice? The famous RICE protocol, rest, ice, compression, elevation, has been the gold standard for decades. But the guy who coined that term has since walked it back. Why? Because ice causes vasoconstriction. It shuts down blood flow to the injury. While this limits swelling, it prevents the arrival of the neutrophils and macrophages we just talked about. It hits the pause button on repair, delaying the entire process. Now, does this mean you should never take a painkiller? Not necessarily, but the impact of inflammation suppression varies significantly depending on what tissue you are trying to heal. Let's look at skeletal muscle first. If you are a gym goer trying to build muscle, listen up. Muscle regeneration relies on satellite cells, which are the resident stem cells of muscle tissue. Studies show that prostaglandins are required to activate these satellite cells so they can fuse into new muscle fibers. If you take high doses of NSAIDs immediately after a workout or an injury, you blunt this response. While occasional use is probably fine, chronic use during resistance training can actually inhibit muscle hypertrophy and strength gains. Basically, you are doing the work in the gym, but the drug is canceling out the chemical signal that tells your muscles to grow. It is even more critical when we look at bone healing. Bone is perhaps the most sensitive tissue to inflammation suppression. When you break a bone, the early inflammatory blood clot is a rich reservoir of growth factors. Prostaglandins are essential for differentiating the cells that build bone and the cells that remodel it. The clinical evidence here is striking. Multiple studies on spinal fusion and fracture recovery indicate that patients on high-dose NSAIDs have a significantly higher rate of non-union. Non-union is a medical term for when the bone fails to knit back together. It is a disaster. It means more surgery and chronic pain. This is why many orthopedic surgeons now strictly forbid NSAIDs for 6 to 12 weeks following spinal surgery or complex fractures. Then there are tendons and ligaments, the connective tissues. These tissues already have a poor blood supply, which makes them heavily reliant on inflammatory mediators to signal for help. Animal studies have consistently shown that while NSAIDs reduce the swelling of a tendon injury, the resulting repaired tendon has lower tensile strength. It is mechanically weaker and more likely to rupture again. This is also why cortisone injections for things like tennis elbow or Achilles tendonitis are becoming controversial. They provide excellent short-term pain relief, but long-term follow-up studies often show that patients who receive steroid injections have worse outcomes after 12 months than those who did nothing at all. The steroid suppresses the pain, allowing you to use the injured tendon, but it degrades the collagen structure, masking the injury while the tissue continues to weaken. So where is the science going from here? We are entering the era of chronotherapy. This is fascinating research emerging around 2025 and 2026 involving the body's circadian rhythms. It turns out that bone and tissue repair mechanisms are often more active at night, during rest. A study involving murine models suggested that if you must take an NSAID, taking it during the active phase, morning for humans, might be less detrimental than taking it at night. Taking it at night interferes directly with the peak window of osteoblast activity. This has led to a phase-dependent treatment approach. In phase 1, the first 0 to 3 days, you should avoid anti-inflammatories entirely. Let the neutrophils and monocytes enter. Use compression and elevation for pain, but avoid ice and NSAIDs if you can stand it. In phase 2, days 4 to 10, if inflammation is excessive and causing secondary damage, like swelling, compressing a nerve, mild suppression might be warranted. But the real future lies in a concept called pro-resolution. For a long time we thought inflammation just faded away passively. We now know it is an active process driven by specific lipid mediators called specialized pro-resolving mediators, or SPMs. These include compounds like resolvins, protectins, and moresins. These molecules are derived from omega-3 fatty acids. They function differently than anti-inflammatories. Resolvins stop neutrophil infiltration and stimulate macrophage cleanup, but they don't suppress the immune system's ability to fight bacteria or signal for repair. The therapeutic shift is massive. Instead of using NSAIDs to block the start of inflammation, scientists are developing drugs based on resolvins to accelerate the end of inflammation. This approach clears the debris and pain without stopping the healing signals. It essentially fast-forwards the process from red and swollen to repairing, without the damaging side effects. So what are the practical clinical implications for you right now? First, we need to rethink RICE. The protocol is evolving to an acronym called Peace and Love. The P stands for protection, E for elevation, A for avoid anti-inflammatories, C for compression, and E for education. The love part stands for load, optimism, vascularization, and exercise. Note the emphasis on avoiding anti-inflammatories during the first 48 to 72 hours. Second, we need to balance pain versus healing. If pain is an 8 out of 10 in preventing sleep, the stress of the pain itself is detrimental. In these cases, using an analgesic like acetaminophen or paracetamol is preferred because it has less anti-inflammatory effect than NSAIDs. If you must use NSAIDs, use the lowest effective dose for the shortest possible time. Third, look at your nutrition. Since those magical pro-resolving mediators are derived from omega-3 fatty acids, maintaining a diet rich in fish oil, specifically EPA and DHA, provides the biological raw materials your body needs to resolve inflammation naturally. Finally, remember that movement is medicine. Mechanical loading, which just means gentle movement, stimulates the release of anti-inflammatory cytokines like IL-6 from your muscles. This helps resolve inflammation naturally without drugs. Inflammation is not a flaw in our biology. It is the engine of our recovery. The symptoms of pain and swelling are unpleasant, but they are the price of admission for high-quality tissue repair. The era of reflexively suppressing inflammation is ending. By understanding the intricate dance of immune cells and repair factors, we can support the body's innate intelligence. So the next time you reach for the ice pack or the ibuprofen bottle, ask yourself, am I helping my body heal, or am I just asking it to be quiet? Thanks for listening to G Fun Facts Online.